Did you know that crushing some medicines can make them ineffective or even make them dangerous? I bet you don't know that. Make sure you watch this video to the end, because the information I'm about to share can save your life. You are part of those that normally crush medicines, put them in juice, dissolve them in water, and yes, some medicines can work even when you have crushed them. But there are some medications that will never work or even become more dangerous when you crush them and take them. And that is why I am here. I still remain pharmacist Ezekiel Ozumba. I created the channel to bring health and medicine related information for my audience, so that everyone that follows this channel, that subscribes to this channel, that follows all my page, will be informed on his or her health and also his or her medications, as the case may be. Follow me as we go right into this video. Number one kind of medicine that you should never crush, and why, is slow release or extended release tablets. You must never crush them. There is a reason why they are made to slowly release their ingredients when taken. When you crush them, you cause the ingredient to be released quickly or faster than it was designed to be. These medicines usually have letters like SR, CR, ER, XL. You must have seen a drug that on the package you see XR, CR, ER, XL, XR, MR, or even LA. These letters are indicative of the fact that they are meant to slowly release their ingredient. So as they dissolve in the stomach or wherever site of the solution in your body, they begin to release the active ingredient little by little, and that is how they are designed to work. If you crush them, all the medicine enter your body at once, or the medicine wearing off too quickly. For example, imagine a water tank. These GP tanks that we normally use in our houses to pump water, to store pumped water. I believe you understand what I'm saying. Imagine this water, that this tank is filled up and it's meant to release water slowly as you on the tap, on your shower, on your taps in your houses, the water. Imagine that the tank is broken and all the water rushes out immediately. It will become, if you are close, it can cause harm. It can cause the environment to be flooded. It can cause a lot of harm. That is what it means when you crush a slow release or extended release medicines. All the medicines move into your body immediately, and that can be disastrous. Yes, it can be. The second kind of medicine that you must never crush are the ones we call enteric coated tablets. Enteric coated tablet. Please follow me very carefully, because many people take medicines and number one, they don't work, and number two, they experience serious side effects that when they come to complain to us or to complain to the doctors are surprised. How can you experience side effects like this? Well, okay, but some might hide the fact that they crushed it, they put it in water, they put it in their Iba. They molded Iba and they put it inside the Iba, not knowing that the environment the Iba created will cause the drug to dissolve or to release its active ingredient even before it gets to the site of action, which is not good. These medicines often have letter EC written on their packs. They have a special covering protecting them from stomach acid. So the manufacturer decided to coat this drug with a covering that will prevent the stomach acid from acting on them once they are swallowed. The coating on these medicines also protect the stomach from irritation. If you crush them, the medicines may be destroyed by the stomach acid. It may also irritate your stomach and it may not work properly. This is what I have been trying to explain. That is the second kind of medicine that you must never crush. The third kind of medicines that you must never crush, never, are the ones we call cancer medicines. Cancer medicines. I know there are people that says, I can't swallow drug if it's not dissolved. I don't do like this. I can't, if I don't put it in molded gari or molded fufu, I cannot swallow it. Be very careful. But the third kind of medicine that you must never crush is the one we call cancer medicines. Many chemotherapy tablets should never be crushed. And you may be asking why. I will tell you why. Because the powder can spread into the air. Yes. And anyone breathing it in or touching it can be exposed to harmful chemicals. Pregnant women especially should avoid handling crushed cancer medicines. Very important. Number 4 kind of medicines that you must never crush are the ones we call hormonal medicines. Hormonal medicines. Some hormone medicines should never be crushed. Please take note. Example of such medicines include medicines for prostate cancer, breast cancer, or hormone replacement therapy medications or medicines. Very important. Crushing them can expose your family members, your children who are close by, because when you crush them, the powder gets into the air and people inhale it, and it can penetrate one's skin and cause harm. Please, I will be glad if you take note of all these medicines I'm mentioning. Yes, I've mentioned them. You can Google their types of, because if I begin to mention the types and everything, this video may be longer than expected. Number 5 kind of medicines that must not be crushed are the medicines that irritate the mouth. Some people don't know that there are some medicines that can irritate your mouth and you become uncomfortable, and all because you decide to crush it. Some medicines are made to pass quickly into the stomach. If crushed, they can cause mouth sores. Yes, they can cause burning in your mouth. They can cause irritation and bad taste. Number 6 kind of medicines that must not be crushed are the one we call sublingual tablets. Sublingual tablets. These are tablets placed under the tongue. Examples include certain medicines for chest pain. They are designed to dissolve quickly under the tongue. If you swallow or crush them, they may not work as fast as they are supposed to work in order to resolve the emergency on ground. Number 7 kind of medicines you must never crush are the ones we call buccal tablets. Buccal tablets. These are medicines that are placed between the gum and the cheek in your mouth. Between the gum and the cheek in your mouth. Like sublingual tablets, they are specially designed to be absorbed through your mouth. Please do not crush them. Don't crush them. Follow the prescription as written, or read the pack of the medications and follow accordingly. Number 8 kind of medicines that must never be crushed is the one we call capsules that contain tiny bits. There are capsules that contain tiny bits. Some capsules contain small pellets that slowly release medicine. Opening and crushing these bits that this capsule contains destroy how the medicine was designed to work. Meanwhile, some capsules can be opened and sprinkled on soft food, but only if your pharmacist or doctor says so, or says it is safe. It is only as instructed. If not instructed, please follow as prescribed. Some people may be asking, how do I know that this medicine should never be crushed? How do I know? I'm not a doctor, I'm a pharmacist. I will tell you how you will know that the medications or the medicines that you are being given are not supposed to be crushed. If you have been following this video, by now you should have known, but I will still reiterate it here so that you will know. Always check the letters written on the drug pack you bought. Like I said, some of these drugs have letters like SR, ER, CR, XL, MR, or LA, as the case may be, on the pack. Some medications can come with enteric coated written on the pack, or EC written on the pack. You can also go through the leaflets of the drug. Does it say swallow whole? If it says swallow whole, swallow whole. If it says you can crush, that means you can go ahead and crush. Please take note of this. Last but not the least, ask your pharmacist if it is okay to crush this medication. Don't assume. Please don't assume. Some people may ask, what if I cannot swallow the tablet? What if I can't swallow the tablet I have been given? What should I do? Please don't force yourself. Instead, tell your doctor. Instead, talk to your pharmacist. Many medicines can also be available as suspensions, syrups, dispersible tablets. For example, we have malaria tablets that can be dispersed. You just put it in the water and it dissolves and you take it. We have medicines like that. We also have medicines that are soluble, chewable, or smaller tablet strengths. This is to say that there's usually a safer alternative. Instead of you crushing a medication or crushing medicines or breaking tablets or opening capsules and all of that, please talk to your doctor. And if there's any alternative that will be given, it will be given to you. Important advice: just because one tablet or one medicine can be crushed, it does not mean that every other medicines can also be crushed. No. That is why I am making this video today, for you to take notes. Always ask your pharmacist. A single question could prevent a serious mistake. In conclusion, before you crush any medicine, please pause and ask, was this medicine designed to be swallowed whole? Remember, like I said, not every tablet is meant to be crushed. Some become ineffective when you crush them. Some become dangerous when you crush them. Some can cause overdosage when you crush them. I believe you learned something new from this video. If you have, tell me in the comment section. Have you ever crushed medicines before? If yes, put it in the comment section. I want to learn from you. Please, before you go, give me a thumbs up. Like this video. Share this video. Subscribe to my channel so that this video can be able to reach others. Till I see you in my next video, remain healthy. Thank you for watching.